sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
So a recurring theme on Broken Healthcare is transparency. We're going to talk about transparency again and again and again. And the reason is it's got to be the starting point, because understanding the cost of things and what we're paying is really going to fix this system. When we get to a place where it's not concealed, where it's not hiding behind a curtain from one insurance carrier to the next, or from one hospital system to the next, when we could plainly see not a charge master list, but what our true cost is for a procedure, services rendered, an operation, an MRI, et cetera, then we're going to really have turned the corner on this. The trouble is we're dealing with entities that wield a vast amount of power. So spending close to $5 trillion a year on healthcare, you could imagine there are a lot of businesses, a lot of organizations, a lot of people that like things just the way they are because it's really working very well for them. The trouble is our fellow Americans are in bankruptcy court. We have over 100 million people in medical debt, and that's just not acceptable. So it really all begins with demanding the cost, the all-in bundled cash price for services. Even if you have insurance, what I would ask you to do is when you call the doctor's office to schedule that appointment and they ask for your insurance card, you could give them your insurance card, give them the information that they're asking for, what plan you're on, et cetera, et cetera. But also ask, now that you've given them something, ask for something in return. What is the cost for this? And if we could band together and everyone within the sound of my voice does that, it's going to start a ripple effect. Because our politicians need to know that the bullshit price transparency law that they passed is just that. It's bullshit. It's nonsense. It's useless. And a lot of time, money, and expense went into more obfuscation, more concealment. We don't need that. So when we understand the cost of things, we'll be well on our way. It really does start there. So I'd like you to think about, what does a medical procedure cost? What should a knee replacement cost? What should hip replacement cost? How could I avoid those surgeries to begin with? Can I take better care of myself to avoid being in the doctor's office? And consumer-driven health plans popped up, I'm going to say, turn of the century, late 1990s, early 2000s. And the idea was high deductible plans that required people to pay a significant amount of money out of pocket to incent them to shop and procure for healthcare. Or more importantly, I don't even think it was that when it first came on the market, it was as a deterrent. Well, maybe if the price is coming, if the cost of this, if they have to pay out of their pocket, they won't be so quick to go to a doctor or receive services. The trouble is, it's an experiment that some can argue, and in certain applications, it absolutely works and is effective. But if you're just throwing that high deductible health plan at people with no education, with no way for them to understand what they can do to help the process, then you've just kind of added another layer of complexity. And what you've succeeded in doing is costing your employees, your team members, their family more money out of pocket, which I don't think is what anyone wants. So the reality is, I think we have to start with the cost of things. And I mean everything. And I don't mean the charge master rate. And I don't mean 200 charge master rates for the same exact thing. That's nonsense. We need to demand more from our hospitals, from our doctors, from our surgeons, and from the system. And they're not all going to comply. As a matter of fact, who knows that they will comply if we don't band together and we keep doing what we've been doing, which is giving them our insurance card and paying our share of the expense and knowing what our cost is based on the insurance, with the insurance contract policy that you have requires you to pay, nothing's going to change. But if we start demanding the cash price, the all-in cash price, the bundled price, including the anesthesiologist, how many of you have gotten balance bills show up in the mail? You had surgery, you did your homework, the surgeon was in network, the procedure was covered, you had an expectation for what your costs would be, and a surprise bill showed up in the mail 6 months later. The anesthesiologist was not in network, and you have another expense. Come on, folks. This happens all too often. And again, it's bullshit. So we need the all-in bundled price for a surgery. And folks, if NYU Langone starts doing it, guess what? Mount Sinai is going to do it. If Mount Sinai does it, guess what? Johns Hopkins will start doing it. If Johns Hopkins starts doing it, the Mayo Clinic will start doing it, and on and on and on and on and on. So it has to start somewhere. And the thing that's going to change healthcare is accountability and market pressure. If we start asking for the price of things, if we start shopping for healthcare and paying cash out of pocket prices for things, the market is going to have no choice but to comply. If all of a sudden NYU starts losing a ton of patients to Columbia because they're doing it, NYU is not doing it, do you think the executive leadership at NYU is going to be happy to see patients going out the door to Columbia because they're obfuscating and concealing prices and they refuse to be transparent other than the bullshit charge master? I think you're going to see an adjustment. And on and on and on. All of the hospitals will be forced to follow suit. And I know there are arguments and there are naysayers out there who'll say, oh, Ray, but what you're looking for, these hospitals to accept, Medicare? Well, most hospitals, if they're run efficiently, are profitable at Medicare rates because Medicare rates are adjusted locally. So, the Medicare rate for a procedure in New York City is going to be higher than a Medicare rate for the same exact procedure in the Midwest. And there are heads of hospitals that will tell you that they make money billing at Medicare rates. But let's say that we're not looking for Medicare rates. We're not looking, certainly not looking to bankrupt our healthcare providers and our hospitals and our institutions, particularly the ones that mean well and are interested in doing good in our communities. Well, 50% more than Medicare is a healthy markup. If you can make money at a Medicare rate and now you're paying 50% more, there should be plenty of margin in that. You could go to 200% of Medicare. That's twice what Medicare would pay. And, maybe in certain circumstances, you can even go up higher than that. The trouble, folks, is we have a system where all day long, these institutions, and some of them claim to be nonprofits and they have wonderful tax advantages and they claim to be charitable organizations. And it's just not so. And these same institutions that are claiming to be charitable within the communities, within our local communities, are charging 500, 800, 1,000% of Medicare and getting away with it all day long. Enough of this horse shit, right? It all starts with us asking for the price. What's the price? What is the all-in cost for the services that you're rendering? It's a very fair question. Can you answer it, please? That's all I got. I'll see you on the next one.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. One lucky listener every single week who posts a review on iTunes will win a chance in the grand prize drawing to win a $15,000 value private VIP day with Ray Kober himself. Be sure to head on over to brokenhealthcarepodcast.com and pick up a free copy of Ray's gift and join us on the next episode.